rhinoplasty is my most favorite operation. Why? Because the rhinoplasty is one of the most complex operations in plastic surgery, because the surgeon has to be able first to fix the breathing problem, and the surgeon has to be able to modify the appearance of the nose, creating something very natural. The surgeon needs to have an artistic sense. The surgeon has to be in between an artist, an expert surgeon, and an architect, because he has to build something that is new. I started to do noses 30 years ago. At the beginning, the nose is more from breathing problem and then cosmetic. I started to do noses with a closed method. Immediately, I love this kind of operation. It's my favorite operation. The surgeon has to understand which kind of nose is the best for the face. There are two methods for approaching this kind of operation: closed rhinoplasty and open rhinoplasty. Because I started 30 years ago to do noses, I'm able to do both. This is a big advantage for me, so I can choose if a patient needs to have a closed rhinoplasty or open rhinoplasty. My opinion is that it's wrong to do open rhinoplasty for all the patients, because sometimes an open rhinoplasty can be an over-treatment. If you can do the same thing with closed rhinoplasty, it's less invasive and the recovery time is shorter. For the patient, it's much better. Sometimes it's necessary to do open rhinoplasty, especially when we plan to put graft. You can take the graft from the septum, you can take the graft from the ears, you can take the graft from the ribs. If the graft is big, you need to do open. Absolutely is necessary. A rhinoplasty is an operation where the pain is very low. Sometimes there is no pain at all. There are some tricks to avoid the pain, the post-operative pain. The most important thing is to do a good local anesthesia when the patient is under general anesthesia. If you use long-lasting local anesthetic when the patient wakes up from the general anesthesia, there is no sensibility on the nose. For hours, he cannot feel pain after the surgery, and is more comfortable for the patient. The procedure will take about between 2 and 4 hours. The recovery time after rhinoplasty is not always the same. If you touch only the tip, for example, the recovery time is very short. If you do the entire nose with the nasal bone, it's quite often also the septum for breathing problem, the recovery time is longer, between a week and a month. The final result after the rhinoplasty can be seen after 5-6 months, not before. The patient can see immediately the result in profile, but the nose is still a little bit swollen. The recovery time changes also if the surgery is a primary surgery or if the nose is already done. And the recovery time changes also if you do a lot of graft. Sometimes the grafts are absolutely necessary, especially in patients that already they had another not precise surgery before, and some part of cartilage or some portion of the nose is missed. Rhinoplasty is one of the most complicated operations in plastic surgery, and the only way to minimize the risk is to choose the expert in this kind of field. In my opinion, A plastic surgeon that does rhinoplasty has to be in the same time expert to do septum, fixing the problem for the breathing. In this way, one surgeon can do both: cosmetic, shaping the nose, and fixing the breathing problem. I think it is important that plastic surgeon has to be able to fix the septum. This can be quite complicated because when two different surgeons with different specialities try to solve the problem on the nose, then to try to fix the problem with only two hands instead of four. I'm Giovanni Ferrando and I'm a plastic surgeon.